ladies and gentlemen, and welcome. Thank you very much for joining me. I'm Dr. Derek Da Silva. It's a pleasure to have with me here today Dr. Evelyn Cintrón. She is from Puerto Rico. She's got two practices in Puerto Rico, one in Bayamón and the other one is in Vega Baja. She's the president and CEO of the Belladona Medical Wellness, which is, as I said, in Puerto Rico. Thank you very much for joining us, Dr. Cintrón.
Thank you.
Pleasure to have you here. So, your topic here at AMMG is intermittent fasting. You're going to be speaking on intermittent fasting. What is intermittent fasting?
Intermittent fasting is a type of scheduled eating pattern that you can plan your meals ahead of time, and you have two different types of windows. The first window, when you're going to be eating, it will be for at least 8 hours, and you have another window for 16 hours. And I know 16 hours sounds like a very long period to be fasting, but actually you can sleep through 8 hours of those 16 hours of fasting, and then before you go to bed, 4 hours before you go to bed, you start your fasting 4 hours, and when you wake up, instead of having this breakfast, what the word means breaking the fast, right? You do 4 more hours of fasting.
So, from what you're saying is you basically eat for 8 hours and you fast for 16 hours.
Correct.
Now, can you drink water?
Yes, you can drink water, you can drink tea, green tea, which has a lot of antioxidant and effects, and also you can use like coffee all the time, water with lemon, no problem.
So you can have the liquids, but what is it that you're really trying to avoid when it comes to the fast? Is it the food?
It's actually the sugar. You're trying to avoid sugar, number one, and most important that you have a rest instead of digesting and eating and processing food. Like a lot of people eat since 7 a.m. And they eat through the day because they heard that the metabolism will go up, and maybe the last meal or last snack will be at 11 p.m. Well, that you will be eating like 16 hours a day. That means that your body will be processing food all day. You don't have time for resting and repairing and healing your system. So the hour time is very important for you to heal and to get those benefits of the cells that we can talk.
I looked at your PowerPoint, I looked at your presentation, and what I learned from that is that this is not a new concept. This is something that goes back centuries.
Yes. Since 1900s, a lot of doctors use it for obesity, for diabetes, and also for patients with seizures. So now it's like a trend because it's something new. A lot of celebrities are doing it. And it's because they've seen the benefits for anti-aging and also because it helps the weight. But there's many, many benefits. The one that I like the most is that it helps with the inflammation of the cells. So we know that's the key of longevity. So if you keep your inflammation of the cells low, you'll have a longer life. Also, there's another thing about autophagy that we were talking about before. It's very interesting how your body, when you're in a fasted state, when you're resting and you're not eating, you start that concept, the autophagy, which is like the major key role of slowing the process of aging. So that's like a repair system of the cells.
Is autophagy the repair system and a cleansing system
like,
also? Does it come
It's easier
that?
to understand, like if you have a car that has like a damaged tire, you have to replace it, but maybe also has the oil that it's not clean, you have to cleanse it. So there's different things that you can do with, for example, for the mitochondria. You get the subcellular parts and you cleanse them, you change them, you replace them, but it will not be apoptosis, which will be completely destroy of the cells. You just recycle the cell.
Cellular cleaning, cellular regeneration, if you will. What are the benefits of intermittent fasting?
Well, the most important in my clinic is weight loss. Of course, if you
Is that what you do? You really focus on weight management?
Yes. And it's actually because If you stop eating, okay, you stop eating. But if you reduce your insulin levels, you know that you will have a better benefit trying to lose weight. So it's more direct to the insulin effect, because insulin is a hormone that when it's too high in your body, it kind of starts inhibiting glycogenolysis, which is the breaking of the glycogen in the liver, and it also inhibits the lipolysis. So you won't be breaking any fast if you have very high levels of insulin.
Why is, I mean, you mentioned this, some of the other people that I've interviewed have also mentioned this. Why is inflammation so bad?
Inflammation is really bad because we're eating all the time, and when you're eating, you activate some pathways in your cells, and IGF-1, it's very activated when you eat a lot. So you get higher risk of cancer, you have inflammation of your cells, and there's a thing that is called the mTOR pathway that is also activated when you start eating and eating. And it also happens when you eat a lot of proteins, because people think that eating protein, they're going to lose more weight. Mm-hmm. Well, not really. You can eat some moderate portions of proteins. But if you eat too much, you will start breaking down in amino acids, but the ones that you don't absorb, they convert to sugar. So that increase also that mTOR pathway.
So mTOR pathway is a damaging pathway, a cellular damage?
It's a cellular damage, but it's also a cellular rejuvenation. It depends how you activate it or not.
I see. Mm-hmm. So what you said something just now is very interesting, proteins. Mm-hmm. Eating too much protein is also not a good thing.
It's not a good thing. It's not good for longevity. You can eat a lot of proteins because you want to build muscles, like people that lift weights. Well, they break a lot of muscles also. But if you are talking about animal or food protein, it's not good to have that many because it increases that pathway. So it's very dangerous, actually.
In your clinical practice, what have you seen with intermittent fasting?
Well, I see insulin reduction, CRP reduction, which is very important for my patients. I see a lot of inches in the waist, the body mass index go down from morbid obesity to just overweight patients. And most of them, the patients can even revert diabetes. If they're starting, with the diagnosis and the insulin levels, I mean, when you drop those insulin levels, you can get that patient to even don't take any more medications, start a new lifestyle, and they get more confidence in themselves, and they see that they have a healthier life, right?
Now, you also said you do something very interesting with your patients. I think you call it Bella Fashion. Tell me a little bit about that.
Well, to me, that's like a graduation after they lose weight. I have patients that have maintained their weight like for 5 years, and they lost 125 pounds. So I get this
Wait a minute.
runaway.
You've had patients that have lost 125 pounds?
Yes. I do have some slides of that patient especially that is going to be shown in the conference.
Wow.
Yeah.
So tell me about the Bella Fashion.
So patients that they lose 40, 50, 60 pounds, I put a picture, I do a runaway.
A runway, like
yes,
a model?
Like a model thing. So I get somebody for them to put some makeup and put their hair very pretty and new clothes, and they just go like models. And it's like a graduation because they feel that they get the gold and the gold, and we put the picture before and after, so their confidence increase, and all the families there. It's like graduation day. It's very nice.
Tell me about one of your success stories. I mean, I know you have lots of them. Is there one that stands out in your mind that really you've changed somebody's life?
Well, I had a 456 pounds person that I started in intermittent fasting.
456 pounds.
And he used to sit down and eat at least 8 hamburgers, one after the other one, because he's got a huge appetite. So when we started intermittent fasting, his brain will tell, you're going to be so hungry that you're not going to be able to do it. and like the ghrelin levels are going to come down. It's not going to be the same as before. So I explained all the things to him, and like the second day he was very compliant with the diet, and he could do the 16 hours because I start 12 hours and then go up to 16 hours.
Okay.
Because it's not so easy to start just in 16 hours every day fasting. So the good thing about him was like I could take him to a yoga class and he will sweat and he will do the whole class, and you will not believe the energy, the mental clarity, and how he felt like a 150 pounds person. So he kept losing weight. And the good thing about it is like one day he said, you know, doctor, this is incredible. I don't know why I'm not eating, and I'm taking any more of the Nexium and the, you know, the medications I used to take for my stomach pain. It was always. So just the teaching to him, I mean, what you're putting now in your cells is completely healthy. Your stomach, it's getting the benefits of it, and your body's just healing. Just to see him go through losing 100 pounds is just amazing. Just the changes that he can do his shoes, legs. He
can bend over.
He can play with his kids and things that he couldn't do before. So that's really amazing.
What do you see as the future of intermittent fasting? Do you see this becoming a lifestyle?
Well, there's many celebrities that have said that intermittent fasting is the new way to go because the longevity, right? But to the doctors, I will say, we don't have many tools to work patients when they come to our office. And maybe they come for something else, but you see they're obese, they have morbid obesity, and you don't know how to treat them. You don't know, you're not going to tell them, go do a surgery.
Right.
I mean, those are not options for us. You're not going to put them in a medication without following for decreased appetite. So this is a very easy tool that any doctor can start in a slow window, you know, a smaller window, and trying, you know, to see if it's good for them, because it's maybe not good for everybody, but most of the patients that they're losing their battle with diabetes and heart disease, this is a great tool, because if not, you know, the outcome will be really worse.
So you're okay with somebody doing 12 hours and then going to 16 hours?
Yes, of course. I think it's the easiest way, especially you have already the rule that you can go to bed, stop eating like 4 hours. We usually do that because we know it's not good to eat and then go to bed because you're going to accumulate all the fat cells. But then in the morning, the trick is to tell the patient, just start, instead of eating at 7 a.m., try to at least give 2 more hours and wait and hold it. And then the next day, try to do up to 10. And the patients train their bodies. And there's another thing very important. You tell them that they will be hungry because the ghrelin levels are going to go up, right? Because at 8 a.m. it usually happens. But you tell them to be ready for that moment, to have the coffee, to go for a walk, to have their brain, you know, think about something else. And if they follow the instruction, they will overcome the hunger. And the good thing is that the ghrelin levels will just go back to baseline, so they won't feel that hungry at all.
And people, I've heard you say that people say, you know what, I forgot to eat breakfast, or I forgot to eat lunch, or so that gets over that. Yes. Thank you so much for joining us.
Thank you.
Thank you for the great information.
Sure.
We appreciate you doing this in English for us, by the way. thank you so much for spending the time. And folks, I hope you enjoyed that. This is a whole new concept, and I hope you will read more about it and actually watch some of the videos that Dr. Cintrón does. Thank you so much for joining us. Until next time, I'm Dr. Derek Da Silva. May you always be blessed with good health.